Gauteng Health MEC Gwen Ramokgopa has resigned. She submitted her letter of resignation last night, just hours before the release of Health Ombudsman Professor Ramokgopa's damning report into the deaths of 94 mentally ill patients between March and December last year. The Provincial Health Department had ended a contract with Life Isidimeni Healthcare and moved the patients to 27 NGOs. All the NGOs operated under invalid licenses.
A long-awaited and bombshell report titled 94 Silent Deaths and Still Counting, the death toll much higher than reported.
A total of 94 and not 36 mentally ill patients have died during this process. 94, not 60, not 80, not 87, whatever you read in the Sowetan was wrong.
A number likely to rise.
There are other agencies that are investigating this process, like the South African Police. They are still investigating. There are corpses that are still in mortuaries that have not been identified, and we don't know whether they form part of this. Not all the information we could get from the NGO was often full. Some of them were actually reluctant to give information.
Patients died of starvation and lack of water in overcrowded NGOs. When the MEC announced 36 deaths in September, 77 patients had already died.
I believe that a combination of negligence, reckless decisions and actions, combined with appalling conditions in some of the NGOs, as revealed through the evidence of the different stakeholders, through the expert panels, through the inspectors of the Office of Health Standards, and through the interviews that I've held, have revealed that there has been excess and unnecessary but preventable death for some of the diseases that have occurred.
The report revealed a possible cover-up. 3 key players fingered are the MEC Gwen Ramokgopa, HOD Dr. Diego Silebano and Dr. Magabo Manamela. The Ombudsman recommends the suspension of the DG and other senior staff with immediate effect, and that they be reported to the Health Professions Council.
You have 3 of the most senior people in a department not knowing a simple number, how many patients have died in the service that they provide. And this is an issue that has engaged and occupied all of us. 10 weeks after that happened, they still did not know.
The National Health Minister, more than embarrassed.
I am not embarrassed. I'm distressed and very angry, actually. It's quite distressing. So it goes beyond embarrassment. It brings anger in you and the distress, because, as the professor said, something like this should have been avoided.
It was further recommended that police hand over its evidence to the NPA and that the remaining patients be moved to public hospitals. Mangoba Mchulu, SABC News.